Hi, and welcome to the How to Survive Healthcare podcast. I'm your host, Kayla Thompson-Riviere, seasoned critical care RN turned independent patient advocate. Tune in every week so that you can learn the things about the U.S. healthcare system that no one ever tells you. That way that you can get the most from it and optimize your health outcomes. Now, of course, this podcast is strictly to inform and entertain and should never be taken as a substitute for medical advice. Let's dive right in. Hi, welcome back to the podcast. Today I want to talk to you about the risk of unnecessary testing. Now, before you throw up your hands and say, this was probably unnecessary, there's more to it than you may think. We'll explore the potential risks of over-testing, how unnecessary tests can lead to complications, and how to ask your doctor the right questions. So, a lot of people believe that the more tests a doctor orders must be more helpful for getting to the right diagnosis, and it must mean that you're getting better care. But in reality, it doesn't always work this way, even though that is a very logical line of thinking. While tests can, of course, provide useful data, they're not always necessary, and if they're overused, they can lead to their own set of problems. Now, the most common issue that probably comes to mind when we talk about unnecessary testing is it translating into unnecessary costs. But how much cost are we talking about? Well, the Institute of Medicine estimates that on average about $210 billion annually is spent on unnecessary testing. I cannot even wrap my brain around this number. I actually went ahead and did the math, and if you take that $210 billion and divvy it out amongst every single person in the US, that's over $600 per person per year. Now, obviously, that's not the way that medical tests are being delineated, but that's just an insane amount of money. So we're not talking about a few peanuts here. It's a lot. Now, this, of course, is a substantial burden financially on the healthcare system. Everybody talks about the rising cost of healthcare, and how the U.S. has one of the leading costs of healthcare per capita, and this is certainly a contributing factor to it. Now, why are all these unnecessary tests happening? We'll dive into that in a few minutes. But let's talk a little bit more about personally the effects that it can have on you or the patient who may be getting unnecessary tests. Beyond the cost, which, by the way, might land on your shoulders and not your insurance companies, especially if they determine that it's unnecessary, there's the risk of false positives. So the more tests that you do, the more likely you are to have a false positive, which then can lead to additional unnecessary testing or perhaps procedures. Oftentimes, it can start with a simple blood test, but if that comes back false positive or inconclusive, it can lead you to more invasive testing, such as CAT scans, which can leave you with radiation, or biopsies. Now, of course, these types of testings do have their place, and I'm absolutely not saying that they're always unnecessary, but they do carry a risk, and we have to look at that when we're weighing out which tests are right for us. Especially when we're talking about things like biopsies, because they come with the risk of infection or complications from the procedure itself. Furthermore, the more testing that you have done, there's a clear correlation between also the more anxiety that you have around your healthcare while you're waiting for these tests, while you're trying to understand what these tests mean, if we're going to need more tests. It's just a whole ball of fun. So, how do we avoid this? Why is it happening in the first place? Well, here in the US, we unfortunately have a very sue-happy culture. And that being said, doctors have to be incredibly vigilant to protect themselves from lawsuits. What this translates to is that we have kind of stepped away from leaning into their medical intuition, and we've gone more to a place where when they're providing care for a patient, it's from the perspective of having to prove beyond a reasonable doubt that a patient does or does not have something. Whereas if we could rely on their clinical judgment alone, we could probably arrive at the same conclusion without all of the tests. So that's part of the reason why we're seeing all of them. Additionally, providers tend to be under a lot of pressure from their patients for them to do something, whether that be tests or medications. We've talked about before how oftentimes when patients are feeling unwell, providers are pressured for antibiotics, even if they're pretty certain that the patient has a viral infection and they're not indicated. So we, from the patient perspective, also need to be mindful that we're not pressuring our provider to do something, and sometimes relying on their clinical judgment really is the best course of action. But how can we determine if we need tests, which tests are necessary, which tests may be unnecessary, and kind of how to go from there? So the key to avoiding unnecessary tests is knowing the right questions to ask. And I have four for here for you today that you should be asking at every appointment when testing comes up. Okay. First of all, what will this test tell us? If the provider says, oh, well, it's to rule out or to make sure that it's not XYZ, that may be worth some further questioning of, is it worth it? I would encourage you to ask this question even with simple blood work. People tend to think, oh, if it's just blood work, what's the harm in that? But let me share a specific example. Particularly from my experience working in the emergency room, there is a test that doctors can order called a D-dimer. It's a blood test, simple blood test. And what this test is looking for is blood clots in the body. We like to use this particularly if we are concerned if someone's having a blood clot in their lungs, because if this comes back negative, the probability that they're having a blood clot is really low. And if we weren't suspicious of a blood clot in the first place, it fits in that box of proving beyond reasonable doubt that it correlates with the clinical suspicion. However, the problem is that this simple blood test can be positive for a variety of reasons, not just blood clots. Therefore, it's really only helpful if we get a negative result. If we get a positive result, then the provider is kind of put in a position where they have to then order more testing to prove that it's not a blood clot, which is a CAT scan with IV dye. So you're talking about the dye, which is hard on the kidneys, and the radiation from the CAT scan. And if that's still just to arrive at a negative result, you can kind of see how this pathway goes. So always ask, what is the test going to tell us? And start to have some critical thinking around if it's the right choice for you. Another question, number 2, will the results of this test change my course of treatment? Sometimes it's really great to have a test to get a specific answer, but if it's not going to change the outcome, then it might not be worth it. Number 3, are there risks associated with this test? Some tests like the biopsies I mentioned before, carry the risk of infection. If you are an immunocompromised person, like our cancer on chemo patients, HIV/AIDS, or immunosuppressants from a organ transplant, just having the testing done, the puncture hole in your body, or even simply being in a healthcare environment like that could actually do you more harm than good. Again, not always. This is a conversation to have with your provider. And the last question, number 4, are there alternatives to this test? Sometimes we could do a test, or we could try the treatment and just see if that works. Sometimes trying the treatment can be more beneficial because it's both diagnostic and therapeutic. Sometimes it can actually be more cost effective too. So that's always a question worth considering. If a test isn't likely to change the treatment plan, it might not be necessary. And I just want to highlight, this doesn't mean that you're refusing tests, but just making sure that they're truly beneficial. It also helps to open a dialogue between you and your provider so that they're no longer feeling that they're in a position where they're forced to do these tests. If there's things that you and your provider agree it's probably not super beneficial, they can put all that in their note, and then that will protect them, legally speaking, and also protect you from all those unnecessary risks. So, while tests are absolutely an important part of diagnosing medical issues, they're not always necessary, and it doesn't always mean better care. If you ever feel that you're unsure about the number of tests being ordered for you or your family member, please reach out to myself or another advocate. This is exactly what we're here for. The fact that we are independent means that we don't stand to gain whether you get testing or not, so we can really be an impartial sounding board for you when determining the best course of action. You can find me at heardforlife.com or reach out on any of the social channels. And don't forget to subscribe and share this with somebody who could benefit from learning this as well. So thank you for tuning in, and I will see you next week.